Okay, so this video is all about CARs and how to use them. So CARs stands for controlled articular rotations. So it's basically just that. We're doing slow, controlled movements of whatever joint we're thinking about. So in this case, I'm going to be using the neck as an example for this video. So controlled meaning slow, articular rotations meaning joint rotations and joint movement. So a few key things about CARs, what they are and how they work. Number one, what we're looking to do is explore our pain-free full joint ranges of motion. Something that what happens to us as we get older or we get deconditioned or we stop training is that we lose range of motion. And why do we lose it? Is because we just don't explore it. And then what happens is when our tissues are not used to being in a certain range and our brain, our nervous system, our neural network and wiring is not used to activating those muscles and tissues to get into those positions, we end up injuring ourselves. We quickly turn and our bodies are not trained and adapted for that, and we injure ourselves. So controlled articular rotations, above all else, is a system of joint health and joint maintenance. So we're working on two proponents here. We're working on the hardware, the soft tissue, the ligamentous capsule of the joint space. That's the hardware. But then we're also working on the software, so the neural network that is activating that movement, that is giving us a proprioceptive map of our environment, meaning that our brain can feel where we are in space. We're engaging in training both of those aspects. So the key thing about CARs is that it's a system of preventing injury, maintaining range of motion that we already have, and exploring new ranges of motion. And we don't need any equipment, we don't need to be anywhere, we don't need to pay for it. It's all right there for us. So this is something that we should do every single day. Another key component of CARs is something called irradiation. And while you watch this video, I'm going to have you experience this with me. So sit in any comfortable position, put your hands together. Now what you're going to do is, just using the muscles and force of your hands, squeeze your hands together, right? Now I start to explore incorporating some of the forearm muscles and your forearm strength. Now go up the elbow to the biceps and triceps and into the shoulder and the pecs and the back muscles. So as you can hear, maybe my voice is changing a little bit. You might be able to see some shaking. So we are irradiating muscle contraction through our body to create tension. So we're incorporating not just the local area, but we're creating a level of co-contraction through the rest of our arms and into our chest and torso. So this is something to keep in mind when we do CARs. So the idea of irradiation, so let's do this together if we're going to do a neck CAR, is we take a breath in, we let that breath fill our belly, and then we gently pack that breath down so there's a moderate level of contraction or control here. So we're not just floppy, we're actually trying to maintain some integrity through our trunk. And now when we do our CARs for the neck, we're trying to isolate just movement in the neck. So when I'm coming forward, I'm not rolling my whole body, I'm not drifting and moving. That has its place as well, but for CARs we're trying to, the mantra for this system, which I should mention is the functional range conditioning system developed by Dr. Andrea Spina, is control yourself. So that's what we're looking to do. We're looking to get a greater sense of proprioceptive awareness of where we are, a greater sense of feeling our bodies and being able to control it in countless varieties of positions, stress, load. So here we go, let's do that again. So breathe in, pack the breath in. Now you're creating a low level of contraction through the belly, through the arms, and this isn't like, you're not squeezing for dear life. There are times during the training when we would do that, but this is just being aware of your body and staying active. Now we're going to bring our chin to our chest. When you get there, roll the chin to the left, keeping that head coming forward. Once your chin gets to your left shoulder, bring your left ear back to the shoulder as far as you can, trying to resist movement through the rest of the body, just keeping in this in the neck. Now let the back of the head drift back as the chin goes to the ceiling. Roll to the right side. Right ear to right shoulder. You should feel a stretch on the left-hand side. Right chin to right shoulder. Back to center. Now that's one rotation, one controlled articular rotation in one direction. Another important thing to consider when doing controlled articular rotations, what we're looking to do is experience sensations on the opening sides of the joint. So when I come to my left and I drop my left ear down to my left shoulder, this side of the spinal joints is opening up. And I'll show you here. So as we come forward and then to the left, I don't know if you can see this on the video, but all of these joint spaces are beginning to open up. And that's what we're looking to explore, more joint space. Now, if when you're doing this, and you come to the left, and you come down, and you get a pinching or pain on the closing angle of the joint. So on the side of the joint that's closing, on the side of the direction that you're going, if you get a pinching or pain there, that is something we do not want to push through. It's an indication of aberrant joint function, meaning that this joint can't close there because there's too much compression. The tissue won't allow to fold in on itself. It's just creating a block. Now, if you get that block, what you would do, say I get pinching right here. So I would take some pressure off and then continue the range of motion. Now, if that doesn't work, say I'm going to my left, pinch. I could just go back to my right, come along, pinch and pain-free. Now, if I come back here, pinch, I would just go back. So you just remove that particular aspect of the range of motion to prevent jamming through an area of our body that's not ready for that. And we would use other methods to then open up that space so that now you can have this full range of motion through the neck, through the cervical spine. So in that sense, CARS is also an assessment tool for you. So it's something that you can do every day to assess, like, oh, okay, oh, that needs more attention. This part of my anatomy, this part of my structure is not functioning as well as these other parts. So these joints can handle those movements. This part can't. So it's going to need a little bit extra attention. So in that sense, CARS is an amazing tool for you to use every single day to, like I said, improve joint space. We're exploring our range of motion that we have. We're maintaining our joint health. And we're also getting a better understanding of where some of our limitations lie and how to work through them, rather than feeling lost about, oh, my neck hurts and I don't know what to do about it. This is an amazing tool for you to begin to assess yourself and start to understand how you can improve. And I will be sharing more tools to show how we can work through those aberrant areas, those aberrant joint spaces. But this is CARS. This is how to use them. I hope you found this helpful. If you have, please leave a comment, send me a message. If you have any questions, I'll be happy to answer any of them. More videos will come with CARS for specific joints, CARS for the full body, so we can do a whole body routine that you can do and should do every single day. And then other videos of how to improve where our limitations are. So thank you so much for watching.